I'd like to introduce Kelly from the United States, who takes LDN for rheumatoid arthritis. Thank you for joining me, Kelly.
It's a pleasure.
Could you tell us when you first started to notice your rheumatoid arthritis symptoms?
Oh, it was a little over 4.5, 5 years ago. I was experiencing some inflammation and pain in my joints, and I'd gone to see my regular doctor, whose wife ended up being a rheumatologist, and I had a practice next door, and he sent me over there immediately. She ran some blood work, but within the first 15 minutes, she said, "You have rheumatoid arthritis, and you need to go on methotrexate immediately, or you're going to start seeing some deformities in your joints." And with that information, I had gone on to see four other doctors for second, third, fourth opinions, and it was of their opinion that they were all in agreement to throw methotrexate, some injectable drugs my way, painkillers, and I still wasn't comfortable with that. And I had finally, by luck, through another person, had gotten to see another MD who practiced both as a naturopath and as an MD, and he suggested that I change my diet, and he put me on a strict vitamin mineral regimen and checked my thyroid and other looked at other blood work for me, and he prescribed high doses of vitamin D3, fish oil, magnesium, and Armour thyroid medication. And I took that for about 3.5, almost 4 years, and my symptoms pretty much disappeared, with the exception of stiffness every now and then in my joints due to bad weather, cold weather. And about a little over a year ago, the symptoms reoccurred. And I went back to my doctor, and he suggested LDN. And it came to me as a surprise to me, because 6 months earlier, I'd had a conversation with my brother, who has multiple sclerosis, and he was telling me about this new drug that he was trying, LDN. Well, actually not a new drug, but a controversial drug, LDN, low-dose Naltrexone, and how wonderful it was working for him. And so now I'm back in my doctor's office, and he introduces it to me, and he said he introduces the LDN to all of his autoimmune patients with autoimmune diseases, and he has success with it. But he usually doesn't see success with it on its own, but usually when it's piggybacked with another medication, such as methotrexate. But he knew how I felt about methotrexate, so we decided to introduce it on its own, the LDN. And I took that December 2013. We started at a low dose. It was 1.5 milligrams. And I remember the very first night taking it, because I had trouble sleeping, I had the best dreams of my life that first night. And the first week I was on the 1.5 milligrams, and then we increased it to 2.5. And I noticed some inflammation was decreasing. I still had a lot of stiffness and some pain, but I noticed it was gradually decreasing, very slow, very slow. And by the time January 2013 rolled in, so I was diagnosed, I was given the LDN in 2012. So January 2013, at the end of June, I was on 4.5 milligrams of LDN, and started seeing better success. My movement, I could move around easier. I wasn't as exhausted or tired. I was sleeping well. My appetite was back. My inflammation was down. And then I went for a revisit in March to my doctor for a re-eval, and I asked him if we could increase the dose to 5 milligrams. And he asked why, and I said, because I think I could get more out of this medication. And just a history on me, I'm not too sensitive to medication. It takes a little bit more medication for me to see results. It's very true with I've had a couple surgeries in the past, and I'd woken up in a couple of those surgeries, and they called it, I have a low pain tolerance. Anyway, so he said he had never given anybody 5 milligrams of LDN, but he would be willing to try it because he didn't see that there would be any. He had not seen any research that said 5 milligrams would cause any kind of adverse side effects. So we put me on 5 milligrams the summer of 2013, and I even seen better results, far better, immediately, like within the first week. And the pain was completely gone. And if I have to scale my inflammation level, 10 being the worst, I was at a 2. Same with my inflammation, I was at a 2, and no stiffness. I was mobile. The only thing is I wasn't sleeping as well. The 5 milligrams seemed to interrupt my sleep. It seemed like I was very active at night. My mind was very active. But I'd take that. If that's the only side effect that the LDN is going to give me, I'll take that any day compared to the pain and the inflammation. And with those results, my doctor decided we alternate my LDN now. So every few weeks, I'm on 4.5 milligrams, and then when those 3 weeks are over, I go on to the 5 milligrams. And it's interesting because the minute we decrease for that first week, I sleep a lot better, but I start feeling a little discomfort, starts settling back in. And the minute I go back to the 5 milligrams, those symptoms subside completely, but I lose a little sleep.
Mm-hmm.
But like I said, I'll take that. That's fine. And it's successful. I'm grateful that this, my doctor prescribed this drug to me because I've been kicked out of chat rooms. I've had controversial conversations with friends of mine who work for drug companies about this drug and its uses, and I don't understand why it's not accessible to other people. It's a crossover medication, but we use crossover medications all the time for different therapies, and this is my success story isn't even half as great as my brother's success story. He has MS, and he's no longer, immobile. He's walking around most days without a cane, and he's functioning. He's got his life back, and the same with me. And I'll continue to take the LDN until, hopefully it will always work for me. And when it doesn't, then I'll visit another route. But until then.
And what would you say to other people who are contemplating trying LDN but maybe a little bit skeptical?
I think I can't imagine a doctor not prescribing it. When I had gone back to my doctor after I had been on the LDN, I'd asked him, what is the controversy behind this? It's like it's a conspiracy with LDN, and he agreed with me. He said he doesn't know. He suggests it to his colleagues all the time, and they just shake their heads that there's been no conclusive, research on it. And he said your patients are research enough, and I think you, as a person with an autoimmune disease, it is in your best interest to look into finding someone that will prescribe you LDN as your first course of action to treat this disease, your disease, because it's easier. Your system tolerates it easier than the methotrexates or the cancer medications or the steroid treatments, and it's a cost-effective drug too. It's a cheap drug in comparison to all the other medications out there, but you see immediate results. And also, I've discovered it could be the cause of my rheumatoid arthritis, but I had some gastrointestinal issues that I was dealing with. They're completely gone, and I associate that to the LDN. My mood as well. My mood has improved and I have to associate that with the LDN. So I wouldn't understand why anyone wouldn't want to introduce something more safer in aspects of taking a drug or medication, because it's still a medication. Well, in America, it's an FDA-approved drug. So, but with the least side effects, that to me would be my first line of attack for my autoimmune disease. That and a healthy diet, and vitamin and minerals. I think that would be the first line of approach for anyone.
Well, it's an amazing story, and thank you very much for sharing it with us. I really appreciate it.